Welcome to Old Nurse Knows. I'm Claire Ketteler, Old Nurse. I offer practical information about health, resources, and encouragement for you to improve your physical, mental, and spiritual health. With over 2 decades of nursing experience, I have been privileged to be with families as their baby is born or their loved one is dying. I have seen frightening injuries and incredible recovery. I spent years studying both medical and nursing topics. In 2021, I left the hospital to work for myself as a registered nurse. I am a nurse who would like to make a connection with you and to offer myself, my knowledge, and my encouragement for you to be in charge of your own health. Follow me. Feel free to check out my website, nhnursehealthcoach.org. Leave a like, leave a comment. I would like to hear from you. Today's topic is What Good Are Old Nurses? Episode 1. Today's quote is, "In all labor there is profit, but mere talk leads only to poverty." Old nurses were around when charting was on paper. Old nurses are not afraid of germs. They will get the job done even if they get dirty. Old nurses have spent many nights watching over your loved one. They've cleaned bottoms, which is your private areas. They've walked with you when you're in pain. They held your hand after you had a frightening diagnosis. They helped your newborn learn to breastfeed. Old nurses listened after the doctor left and you still had questions, and they taught you how to care for some new yucky medical thing. Old nurses will explain what they're about to do to you and what you can expect to feel. They can walk into a room and immediately take charge to solve the problem. They will explain your 10 medications to you. They will sit with you when you are feeling like you want to slit your wrists. Old nurses are generalists. Old nurses consider all of you, so we are holistic. Old nurses have studied disease and how to help you cope with it, and then we spent years applying this knowledge in all kinds of settings and with different individuals perfecting the art of nursing. Old nurses love to learn, so we keep seeking new information in order to help you live your life to the fullest. Old nurses are not like a phone app. And finally, old nurses have witnessed the transformation of healthcare to something that does not seem to be about good health. So, as an old nurse, I would say that you, yes, you, have the greatest control over your life and health, your physical body, your outlook, your happiness, your ability to do what you dream about, and your hope for the future. I'm an optimist and a doer. I can't sit still. I can't sit on my hands or keep quiet. I am also an insatiable learner, a student of life. I don't give up easily. This is the perspective that I bring to you, whether you are young or old, or someone who's just looking for a little hope in these tough times, or someone who is trying to cope with a health challenge. I'm here for you. My plan is to show you how you can be in charge of your own health. I did not always want to be a nurse. When I was 6, I had a ruptured appendix, and after emergency surgery, I spent a week in the hospital getting twice daily antibiotic shots. I hated those painful shots and consequently disliked the nurses. I once hid behind the bed of my roommate in traction to avoid my shot. I became a nursing aide in a nursing home during high school, and this confirmed for me that I did not want to be a nurse. I was very interested in biology then, thought about being a naturalist, and then dabbled as a park ranger. When I moved to New Hampshire, I couldn't find a job, so I settled for delivering telephone books. Unlike today, there were very few jobs available. This was a depressing time for me. I did find some other jobs, but eventually, after the birth of my first child, I decided to become a nurse in order to become a nurse midwife. However, it was not an easy road. I was nearly kicked out of nursing school 2 weeks before graduation and had to repeat an entire year of nursing school. My grades were fine, but the clinical instructors didn't like me. I persevered. The birthing unit where I was working closed, and then my midwifery preceptor said, "I hate you." Getting to be a nurse was challenging for me. Accepting that I was not going to be a nurse midwife was very difficult. So how does one pick oneself up after a failure? If life gives you lemons, make lemonade. I have this character quality, perseverance. I really hate someone telling me that I can't do something. I revel in a challenge. As I repeated my last semester in nursing school, I worked as a licensed practical nurse in home care with children on a home respirator. And then as a registered nurse, I worked in labor delivery. Then I worked in medical surgical nursing. Then I switched to psychiatric nursing. And then I moved to hospital discharge planning. Now I've come full circle back to home care and added a new dimension, nurse health coaching. Nurse health coaching is a way to partner with an individual so they can reach their own health goal. This power for every single person to be in charge of their own health is so big and so transforming that I have to share it with you so that you can take charge. I'm in New Hampshire, the Granite State, the live free or die state. New Hampshire participates in a reciprocal RN license, which means that I can practice as an RN in over 30 states in the U.S. with my New Hampshire license. For me, it is a much improved life to be at home with my husband, comfortable house, 4 dogs, chickens, trees, and nearby trails. I no longer have to drive 75 miles round trip daily. I can do health coaching by video or phone. I'm very blessed and thankful about how things have turned out. I would like to share my joy with you. I really enjoyed helping people get out of the hospital, and now I'm helping people stay out of the hospital and live a healthy life. Nursing changed when masks, face shields, gloves, and low touch became requirements. I experienced trouble communicating and building relationships when I went into a hospital room looking like a contagious Martian. It became impossible to have a low-stress conversation about what needed to happen to get a child discharged from the hospital. Due to masks and face shields, patients and families complained about not being able to hear me. I often resorted to yelling to make myself understood. My heart just broke when I heard again and again nurses reminding a toddler during their months-long hospitalization to put on their mask. I got burned out in the hospital, especially as a result of masking. I lost my way in all the new policies and rules. It was hard to see if people ever smiled anymore. I didn't think anyone did. I over-exaggerated my smile so that the crinkles at the corners of my eyes would be visible. Nurses have been ranked the most trusted profession for 20 years by a Gallup poll. Will that continue? I hope so. And I plan to do all that I can to earn your trust. My nursing art was damaged by not being able to connect with people. I also saw things in the hospital that did not match my nursing practice, so I left, and here I am, an old nurse offering to partner with you to help you be your healthiest you. So today, look for something good. Are you breathing? Do you have food to eat? Do you have a place to sleep? Do you have clothes to wear? These are all good things. Can you see a deep blue sky or a beautiful sunset out your window? Or is the sky watering the grass to make it green? Did someone hold the door for you? Or did someone smile and say hi? Or did you smile and hold the door for someone? Did you sing a song or hum a tune? Did you taste some good food? Did you laugh at something funny? Every single minute in life is precious. Every person on earth is unique, special, and valuable. Your body is an absolute marvel. I will plan to describe to you just exactly how marvelous your body is throughout my episodes. Because your body is so incredible, you actually have way more control than you realize over your own health. Join me again to hear about your incredible body and how you can take control. So remember, in all labor there is profit, but mere talk leads only to poverty. So I'm off to care for a client and then weed the garden, and maybe I can get a run in. Till next time, this is Claire on Old Nurse Knows. If life gives you lemons, make lemonade, and then enjoy your lemonade. Visit me on my website at nhnursehealthcoach.org.